Hi, my name is Dr. Harold Hong. I'm the medical director here at New Waters Recovery. To tell you about what we're doing for the detox protocol at New Waters Recovery, we're using the latest in addiction science to use a protocol that is safer, faster, and more comfortable than the traditional way of getting people off of alcohol.
Sit safer and more not for head.
That's a great question. So what makes this protocol safer and more comfortable compared to the old way is the way that we use medications to treat the problem more directly. In the old way of treating things, we use something called SIWA, and it's symptom-triggered therapy, meaning we actually wait for symptoms of alcohol withdrawal to manifest before we give you medications to calm that down. And the reason that people have these symptoms is there's actually a brewing storm of adrenaline and glutamate. These are neurotransmitters in the brain that cause overactivity.
And so who is the best candidate for this kind of protocol?
Sure. People who have been drinking regularly for about 30 days would be a great candidate for detox. And the reason I say this is the brain protects itself from alcohol by making a lot of adjustments to how it operates. And if you suddenly take away alcohol from the brain, it overreacts because it's not used to being without alcohol. And this can lead to a very comfortable and sometimes very dangerous clinical situation.
And you mentioned that it was new, this detox protocol is new, and has it been tested before in other spaces?
Right. So is this a new protocol? Yes and no. So in a lot of ways, this protocol is building off of science and clinical trials that have been taking place over the last 20 years, actually. And this protocol has been used extensively in the Stanford health system over the last 10 years, and also the surrounding Kaiser Permanente health systems in the Northern California area. So it's actually very well practiced and validated, but what makes it new is that it was recently published in one of the JAMA journals, the Journal of the American Medical Association. So about 8 months ago, they published a large trial involving thousands of patients that showed that this new way of treating alcohol detox is faster, safer, and more comfortable for patients.
And does every patient who comes, or every client who comes to New Waters, do they all experience this detox protocol?
Sure. So this detox protocol is specifically for people who are getting off of alcohol and benzodiazepines. For opiates, we would use a totally different set of medications. So the new protocol is what we would call a benzodiazepine sparing protocol. And this approach fixes a lot of things that were problems with the old way of doing things. So first, the problem we would see is we need to wait for clients to feel unwell before we give them medications to help them feel better. And that is unnecessary when you can actually treat the problem more directly and keep them comfortable without waiting for them to have problems. The second thing that this fixes is that the use of benzodiazepines like Ativan in the old protocol, it can actually cause people to feel very uncomfortable. People describe feeling dopey or out of it or in a haze. And this creates a third problem where they're not able to actually engage in recovery-oriented therapy sessions because they're so under the influence of the benzodiazepines. The new protocol minimizes or even eliminates the use of benzodiazepines. And instead of using Ativan, we can use medications like clonidine or guanfacine and also gabapentin. And those medications directly calm down the storm of adrenaline and glutamate that most patients would be dealing with if they didn't have these medications.
What kind of feedback have you gotten from clients who have been involved in this new detox process?
Right. So what gets us really excited about this new protocol here at New Waters is the great feedback we're getting from clients. So on hospital day 2, they're talking to us and saying, I don't feel like I'm going through detox. Are you sure you're doing a detox here? They'll say, I've never felt so comfortable. Like, this is completely different from every time I've detoxed before. And the staff are noticing that they're able to get into therapy right away. They're not in bed feeling miserable for several days before they start talking about their core issues. So what really makes this protocol unique for New Waters is it unlocks clients' ability to really engage in the holistic treatment that we have here. If you're not feeling well because you have lots of withdrawal symptoms, you're not really going to enjoy your IV hydration therapy. You're going to have great difficulty you're going to have great difficulty working with the massage therapist or the acupuncturist. But when you're thinking clearly and you're not having withdrawal symptoms and you're not feeling under the influence of benzos, you can completely engage in these types of treatments. What I love about working here at New Waters Recovery is I get to experience genuine joy on a daily basis as a physician. And the story that really captures this most perfectly for me is actually one of our very first clients. When he walked in the door, we sat down and I asked him, "What brought you in here today?" And he said, "I'm tired. And I want to be free of how this is controlling my life." And he literally broke down in tears of despair at how alcohol had completely taken control of his life from him. And on the day that he discharged, we had a nice sit-down chat, see how things were going, see how he felt about leaving. And I asked him, "How do you feel today?" And he broke down in tears. I was concerned for how he was doing, and he said, "These tears are different. These are tears of gratitude. I feel so thankful for seeing things in a totally new way and that I can get my life back again." And this is, without exaggeration, what we see every day here at New Waters Recovery.